Hey guys, it's Dr. Roberts from Nashville Neck and Back, and we're going to jump into another reaction video today. I was kind of torn in between two different channels, two of the most recommended channels in the comments of the previous videos, and that is between Dr. Beau Hightower and Dr. Rahim, who does a lot of Gonstead technique. So I was kind of torn between the two. I will get to Dr. Rahim soon because, like I said, he does Gonstead, and I am a huge, huge fan of the Gonstead technique. I used to do a lot of it in school and when I first got out. But as I was perusing through Hightower's page, one video in particular caught my eye, so we are going to react to that video, and we're going to jump into that right now. All right, so let's take a look here at Dr. Beau Hightower's page. He has a huge YouTube following, 1.69 million subs, gets tons of views on all of his videos, and as you scroll through his videos, one thing that you will notice is that he does a lot of videos on professional wrestlers, which is absolutely awesome. So some of you that are new to my channel may not know that I was actually a professional wrestler for 10 years before I got into chiropractic. From 2000 to 2010, about half that time was spent wrestling for TNA all over the country, some time in Mexico, a lot of time in Puerto Rico. But the reason I'm picking this video of Sabu is because Sabu's awesome. We got to wrestle against him in TNA and some other shows. And actually, speaking of Puerto Rico, we did a tour down there with Sabu where we got to hang out with him a lot. Super cool, super down-to-earth guy. So that's the video that we're going to dive into today. But as you can see, if you just scroll down, he's got tons and tons of videos. What he's mostly known for is this one right here, like the hammer and the chisel and the spikes and the I don't know, whatever it's called. We're going to dive into the Sabu video now. Hopefully he does that in this video, so I'll be able to comment on that and react to it. But anyway, enough talking. Let's take a look here.
What's going on out there, YouTube?
Sabu.
Today we are with the extreme hardcore legend Sabu, multiple-time heavyweight champion back in the 90s. He's been with WWE, TNA, been all over the world. Nephew of the great Sheik, right?
Right.
Yep. And he's put his body.
And a man of few words, if you can't tell.
A lot over the years. So we have a couple mutual friends, including DDP, who talked to him. He's getting into the DDP yoga, so that's going to be really awesome for him. He's got a bunch of stuff going on. He's got a book out right now. Where can they find that?
So I'm sure they're going to talk about this. Well, I don't know if they go over his history, they'll talk about this. He's had a ton of injuries. You can go back on YouTube. He had a serious laceration of his arm. I don't even know how he finished the match. This guy is like as hardcore gets. I'm sure his hips are destroyed. I'm sure his knees are destroyed. There's no telling what kind of treatment they're going to go over today, but this should be pretty good.
ECW.com.
There you go, realsabuecw.com. So go check that out, look it up. We'll link that in the section below. He's out on Twitter right now. He's got about 11,000 followers, so make sure to go follow him over there. Today we're going to be working some of his injuries. He's been dealing with some lower back pain. Got dropped on his head a few times, neck's giving him some fits. So obviously he really sacrificed.
Yeah, I believe he fractured his neck too. He got spiked
so we're gonna
directly on
to
it.
patch him back up. And yeah, he's also got an action figure out. Previously had one. We'll put that in the link below. So you guys want to support him again, you can get that action figure, get that book as well. Go show him some love.
So this is pretty awesome. Take the chiropractic aside. I love that he's plugging away at Sabu. Hopefully he does this on a lot of the wrestlers that he treats, but especially the older guys, the guys that kind of past their prime, where they're either unable to continue to wrestle or their appearances are very limited, and once you stop getting in the ring, the inflow of money stops as well. So unless you're marketing and you're branding yourself some other way, financial struggles can be a legitimate issue with some of these guys that are out of the business or, like I said, past their prime. So the fact that Beau's taken time to plug all this stuff, all of his merch, his social media stuff, all that stuff, hats off to Dr. Hightower for that. I appreciate that. Not to say that Sabu's hurting for money. I don't know his financial status. I'm just saying, in general, that's pretty cool.
Instagram as well. You guys doing YouTube yet?
No.
Not yet? Well, look for a YouTube channel coming soon, so we'll help you get set up
Man,
for
a
that
few
too.
words.
And then other than that, you a little bit nervous? You ready to rock and roll?
Ready.
Ready. Let's go.
Nothing really bothers me that much other than my hip and my lower back came now too, but I can live with that.
Okay. And you just wrestled, what, 2018, 19? You did a match?
A few months ago.
Oh, wow. Okay. And you were tag team partners with Rob Van Dam for a long time, right?
Yeah.
And you guys are both Vegas-ites now?
Yes.
Yeah, you live it out here?
Yep.
Yeah. Okay. So tell me about the therapies you previously had for your back.
He's not like I don't know if he's just not having a good day, not in a good mood or whatever, maybe whatever. He's just trying to get through this. But Sabu's actually a really awesome dude. And once you get to hang out around him, he's not like, yes, no, yeah, no. Maybe he's just having a bad day.
And also for your hip. What's worked, what hasn't? And then tell us about
Or he could be in a lot of pain.
What's going on with your back and how that's getting in the way
Well,
of
the
your
hip I
life.
had surgery on, so that worked. The hip don't bother me.
Good.
The lower back, I fell down and never got better about a year and a half ago. Usually I recover from my injuries quite well. This one I can't recover.
Okay.
I haven't recovered yet.
So you had the hip surgery. Was that replaced? Is that what they did?
Place.
Okay, so that's a lot better now, you said.
Yeah, it's great.
Okay. And then the shoulder, you haven't had any procedures done on that? Okay. And then neck. What's with the neck? It's just very stiff?
It don't bother me that much anymore. Not nearly as my back.
It's mostly the back.
It's my back, yeah.
Any pain when you do that?
Yeah.
Okay, where's that at?
My back.
Like dead center?
Yeah, right here.
Okay. And that hurts too?
Yes.
Feeling pretty good?
Yeah.
I'm gonna hold right there. What I want you to do is lean your upper body to the right.
Oh.
And then go back to center. And then again back to the right. And back to center. So tell me when that spot starts to fade away. It should take about 30 seconds or so.
When it fades away?
Yeah. So breathe through it, my friend.
I feel like you're sticking me with a knife.
Yeah, it's just my thumb. Sometimes we get into thumb stuff around here. There we go. Is it starting to fade?
Yeah, I think so.
I'm guessing, I can't see, I'm guessing he's
Stubborn
digging
spot
in
right
on
there.
a trigger point
I was used to
until
I
it
guess.
calms down.
Yeah, it's actually fading.
Yeah. Took about 45 seconds, I guess I lied there. A little more extreme, my friend. Okay, I'm gonna do the same thing right there. Is that one as bad or not really?
No, not as bad.
So how does the left side feel compared to the right now? Do they feel any different?
It feels pretty good, actually.
Left side feels looser?
Yeah.
Buddy Josh running back and forth from a wedding. It's funny. Better?
Not as bad. Not too bad.
What was your finishing move again?
I got a few of them.
Yeah.
It was a Arabian press
Oh, that's right.
or a triple jump moonsault one.
That's right.
Elephant drop. Ain't too be funny.
I'm at the RKO.
That's crazy. Tender there?
Yes.
Yeah. Just keep breathing. Let me know when that calms down, when it feels better. How's that feel?
You know, I don't know. It hurts.
Hurts your leg down.
Yeah.
Show us where.
It's crazy that this guy can even
Like off to the right a little
walk.
bit.
If you're not a wrestling
Right
fan,
there.
if you are, you know what I'm talking about. But if you're not,
Just feel some.
do a simple
tension in there.
YouTube search of Sabu and just watch some of the crazy
your
stuff
uncle
he used to
get you
do
into
back in the
wrestling,
day.
or-
This guy
or
was
you just wanted to
legitimately
because you watched
hardcore
him?
before
So he showed
hardcore
you
was
the
even a
ropes and
thing.
taught you.
Yeah.
That was better. That hurt less?
Yeah. It feels better.
Yeah, let's move better. Probably more of the same.
Yeah.
Did you get it repaired or do you just let it roll?
I just let it go.
You are extreme, man.
Got it fixed.
You are extreme.
All right, so they're obviously doing a bunch of testing.
About Dr. Shaw
Let's get
and
to the
Dr. Magic
treatment.
Hands. Hamstrings, but sometimes you have to work distally too. You know, to create the hip extension you want.
So some scraping
Sometimes by
here.
deactivating the hamstrings
Yeah.
allows it to max engage more.
Oh.
Relax. Is that the worst spot?
I'm not sure if that's a Graston tool.
that?
Graston
Is that the worst
technique
spot for
is
you?
a scraping technique
Yeah.
Pretty intense.
that breaks up those
Think we're
muscle
getting better now?
adhesions. It's usually super uncomfortable, especially if you have issues.
Really valuable.
Oh. Killing me.
And what a lot of practitioners will do is,
Less pain in the back that time?
Yes.
let me
Yeah,
pause this while I'm talking. What a lot of docs will do is they'll use a tool very similar to what you've seen in previous reaction videos, or if you watch any other chiropractors on YouTube, like Mondragon or all these other people that are doing that gua sha or whatever it's called, the scraping, and they're breaking up those adhesions, and it looks like somebody's back is about to bleed. Very similar, a little different between that and Graston. I think what they are doing is targeting at releasing toxins. I don't know. It makes my head want to explode anytime I hear a doctor saying we're going to release your toxins. If you want to release your toxins, like legitimately release your toxins, get better sleep, try to reduce your stress. I know that's difficult. Exercise and eat better. That's how you naturally can release toxins in your body. All this superficial scraping stuff is, yeah.
It's stronger.
It's good for YouTube. It's good for
A lot
clicks.
better, huh?
Yep.
Yeah, way better.
Faster and higher, raise.
Yeah, feels better.
I'll show you a couple exercises when we get done here that you can start doing like daily. That should help a lot. Just take a little ball and you put it on the edge of the table and just work through these muscles.
Can you feel it? Can you feel how it's all connected?
Yeah.
Does it make sense as we're going?
Yeah.
Yeah. Right there's the worst.
Yeah,
Nice.
that calf can be super tender.
Good chance from here.
That's pretty good.
Feel better?
Yeah.
So I'm not sure if that's some kind of vibration or electrical pulse or a little bit of both. Probably a little bit of both.
Shots. Yeah. Not quite as painful, right? Yeah.
That's a tight one there.
So you bend forward again. Let's see how that feels.
So he's loosening him up pretty
What'd
good.
you feel there?
What else are they going to do here?
So my name's Tyler. I'm the rehab technician over here at Elite OSM, and today I want to show this guy here the hamstring release.
This
So
guy
you can do
here.
that with,
Come on. It's Sabu. Know his name. It's not this guy here. Look at Sabu's face. He's like, seriously, kid?
with a lacrosse ball or anything similar. So a baseball would work just fine as long as it's pretty hard and about this size. So what we're gonna do is we're gonna sit at the
Yeah,
edge
kinda
just
boring.
like what we're doing now.
So are they not going to
We're gonna take
adjust?
4 fingers,
They're just going to do muscle
place it
work?
behind
What's this
my-
right here?
Good job. Keep going. Keep going.
Oh,
keep
maybe
going.
not.
What's that?
Huh.
Feels looser now.
What are they doing here?
Push your work.
Must be taping. Well, it doesn't look like it.
That feels.
Yeah, it feels good.
All right, so I guess that was kind of a flop as far as reacting to some of the more outlandish stuff like the hammer and stuff. But I tell you what, let's. I'm glad I watched this one. I wanted to react to it just because it was Sabu. Love Sabu. Let's go back to his channel here. Who else do we have on here? Kurt. He was at TNA with us. X-Pac. So Sean, this is a funny story. All right, so let's click on this one. Let's take a look at X-Pac or Sean. Funny story. We were supposed to do the main event with him. We were filming in Universal Studios Orlando. It was me and my tag partner Chase Stevens. We were the Naturals, and I believe it was supposed to be. Oh man, I should have looked this up. It was either a tag match or a 6-man tag with AJ Styles, Jeff Hardy, and Sean. And Sean completely no-showed, and they had to switch in somebody at the last second. And I want to say it was a pay-per-view. It might have been an Impact taping, but I want to say it was a pay-per-view. Man, I'd have to go back and look that up. But yeah, other than that, Sean was a cool guy backstage, other than the time he no-showed our match at the last minute.
Them together and that's
So
your
let's see
belly
here.
really relax.
We're not going to watch the whole thing. I'm not going to react to the whole thing. Sean's a cool guy. Been through similar stuff that I've been through. Similar story.
Legend, member of the clique.
Let's just see if there's any
you name it, he's been there.
hammering going on
He's
here
got
with
his rings being the
X-Pac.
WWE Hall
Oh,
of
here we
Fame.
go. Let's take a look and see what this is all about. Because I know this is what Hightower's known for.
Tuck the chin a little bit. Deep breath in. And
Moving on.
Shoulders there. All right, here we go.
Okay, turn your head to the right all the way. And keep turning. Keep turning. Keep going. Go a little further. A little further.
All right, so to me, and again, I don't have this technique in my office. I don't use this. This is just my opinion from an outsider looking in. I've not taken any courses on this technique. I've not taken any continued ed seminars. So again, just my opinion. It looks like he's basically replicating the same type of treatment that an activator would perform, but he's doing it with a handheld tool and a hammer. Now, if you're not familiar with what an activator is, a lot of chiropractors use it, especially a lot of chiropractors that work on pregnant mamas and newborn babies. It's a lot of people call it the clicker. It's a little silver, I don't even know how to describe it. It's a little silver piece that fits in the palm of your hand, and it sticks out a little bit, and you can squeeze it like that, and it makes a little clicking noise. And basically, instead of the chiropractor delivering a high velocity thrust, turn, or twist, the tool does all the work, and it's not as impactful. It's not as forceful. And to me, that's what this looks like. Now, if I am completely wrong, please correct me in the comments below. I'm just giving you my opinion of what this appears to be. So instead of taking that activator and squeezing it and the activator performing the adjustment, it appears though that they're just doing so with a different tool. I don't know if he came up with this. I don't know if he developed this, if he was the first to do it. I don't know if it's, I don't know. Let's keep watching and we'll see if they say anything about it.
Good. Back to center. And let's go left all the way. Keep going. Keep turning. Keep turning.
What's the, shit. All right, so the hammer says gear wrench.
A little further. Good. Back to center. And look up to the ceiling. All right, back to center. And then push your head straight back.
Same tool, different hammer. Not sure. Maybe different force.
Keep looking up. Keep looking up.
So it could be a different
A little further.
treatment. It could be delivering a different therapeutic benefit, or it could just be a gimmick that's worked extremely well for him on YouTube. Because if he was just doing that same thing with an activator, it'd be pretty boring. But the fact that he's got a big giant hammer and what looks to be like a spike on somebody's spine and he's smacking away, it's going to work for YouTube. So
It's gonna be snug for about 3 seconds.
All right, cool.
So
Yeah,
just
you can do it again. You can
all
do
right,
it.
so
Just
let's see
bite
what
your
else.
teeth
We don't
down,
have to,
hold them
again, we
together,
don't
and
have to
let your
watch this whole
belly really
video.
relax.
Oh, here we go. Here's another.
It seems I notice it's a little bit harder now that you mentioned it.
Yeah, so again, just that light tapping to me is very similar, if not the exact same, of what the patient would receive if they were just using an activator on that same part of the spine.
Raise this one up again.
I could be wrong, but again, that's just what it looks like to me. All right. Anything else? Going up the spine.
Not as much as people think.
Always be more.
All right. Anyway, guys, that's Dr. Beau Hightower. I'm sure this video won't get as many views or clicks just because if you go back and look at his channel, all of his thumbnails, he treats a wide variety of patients, including a lot of athletes, professional athletes, celebrities, but they usually have their clothes on. They're not all just half-naked women all up and down his page. So again, it is what it is. It's the YouTube algorithm. I hope you guys enjoyed this video. I probably will do Dr. Rahim next as far as a reaction video goes. If not him, he will be soon. I know a lot of you guys keep requesting that reaction video, and I promise you I will get to it. But anyway, guys, again, thank you to Dr. Beau Hightower. And if you have any other creators, chiropractors, any weird channels that you want me to react to, leave those in the comments below. We'll see you in the next video.